and I am also the director of Calcutta Cure Line Infertility and IVF Clinic. And with regards to today's topic, we are going to discuss about the irregularities of menstruation. And I'll take the question answer sessions at the end of this program and try to answer some of your questions or queries as it pops up. Menstruation, as you all know, starts with menarche, which is the starting point of menstruation, and which starts usually at the age of 11, 12 for the young girl, and it could be as early as 9 years of age, and it could be as late as 14 to 15 years of age. So, in the meanwhile, while a patient who is menstruating, she in the irregular phases of menstruation, the cycles are usually very irregular because they are anovulatory cycles. That means no egg is released in the previous part of menstruation, and that's why the periods are not regular like a matured young girl who is around 28, 20, 29 or earlier as well. So to start with, irregularities of menstruation are common at the extremes of age. As you could see, extremes of age means early when the menarche starts, there will be irregular periods, say 6 months to 1 year, till the the axis which supports the menstruation, the hormonal axis, that we call it as hypothalamo-pituitary axis. It acts to support the period and get ovulation done. So it gets matured over a period of time, say 6 months to 1 year. So initial part of periods that a young girl is getting is usually irregular, erratic, and sometimes disturbing, sometimes heavy also. And but this is absolutely physiological, so there is no need to worry. And we usually give reassurance to the young girls, and if required, if she's having some heavy bleeding, then we give her some iron tablets to support and explain her the whole thing. So this is the initial part of a period, and later on, when we are having it at the extremes of you know uh, age, at the age of 47 to 51, 52, so when we are getting menopause, then also the periods gets anovulatory, and there will be menstrual irregularities. The irregularities, I mean, the dates are all over place. It's not like a 28-day cycle where ovulation occurs. So this is the usual pattern. The early part is irregular, the latter part is irregular before menopause, and in between, if there is any issue, then the periods tend to be irregular and sometimes heavy, which may be a case of concern for some patients. Now, to start with, irregularities of period in the initial part, when a young girl who is having severe periods and irregular periods and heavy, then we need to investigate her to find out if there is any pathological condition or cause which is causing her menstrual irregularities. First, we do some blood tests like hemoglobin and thyroid and so on to find out if there is any irregularity, if there is hypothyroid, if the hemoglobin is too low, and then we try to find out by doing scans if required to find out if there is any internal pathology. Usually, it is not found in the earlier periods, but in the later ages, when we are talking about irregular menstruation at the age of say 47, 48, 49, then sometimes we can find some anatomical condition where the periods may be irregular, like the polyp or endometrial thickness, which is too high, and which could be, in some rare cases, lead to cancer if it is not detected early and treated early. So these are the usual causes of irregularities of period in the earlier part and also in the later part. Talking about irregularities of periods in the middle part of life, which is say from the age of sexual reproduction from say 15 to 44, we may find that this can be uh, due to some uh, pregnancy related issue like retained product of conception of pregnancy. Sometimes patient may be pregnant and then she is having bleeding and irregular bleeding like threatened miscarriage, missed miscarriage, and so on. So we need to investigate them more in line of pregnancy. What I mean to say is, in short, that the patient should be investigated by the doctor concerned and she has to be treated accordingly. Like if she is pregnant, then obviously the pregnancy related issues need to be addressed. If she is not pregnant, then also the, the issues which is related to the hormones, PCOD, etc., that needs to be addressed as well. So, so the complete story about irregular menstruation is to have the knowledge of why am I getting this irregular period. Sometimes the causes are very, you know, mild, and sometimes in very rare occasions at the extremes of age when the patient is around 50, 51, we need to find out if there is any sinister or bad pathology which is causing this irregularity. So, for the patients who is having irregular periods, sometimes it is a bit of a nuisance. Uh, so we can investigate them to find out if there is any cause of concern and then address accordingly. What we need to understand is there is no need to panic and there is no need to create a big, big issue out of irregularity of period. As I have said, in the initial part of a child's menarche, the periods are usually irregular. As long as she is not getting anemia, she is okay with it because the periods will eventually set into a known pattern of 28 to 30 days of cycle. But nowadays, what we are seeing mostly, if I am not talking about irregularity of period with respect to pregnancy and pregnancy related causes, mostly what we are getting nowadays with respect to irregularity of period are patients who are polycystic ovarian syndrome. I mean, that has increased in leaps and bounds, and patients usually get a delayed period and sometimes they get irregular period as well. And so we call it as secondary amenorrhea followed by periods. So the periods are all over place. Again, the culprit is anovulation. That means she is not ovulating properly. That's why she is not getting a 28 to 30 days cycle and the periods are not occurring regularly. The PCOD is a major hindrance, and it is the culprit causing the irregularity of periods. And sometimes the patients feel that maybe that he is not having adequate period and things like that. Sometimes he makes a mistake that he is having periods which is irregular. Other thing is some of the patients they have a tendency to overuse drugs of their own, and that's why if that be the case, like someone who's had an unprotected intercourse, she might take unwanted 72 and her periods get delayed and sometimes irregular. Like sometimes some of the patients tend to take oral contraceptive pills but they are not taking it in proper dose and they are not timing their oral contraceptive pills properly. In that case also they might get irregularity of periods. Sometimes someone who is having oral contraceptive pill may have some other diseases like liver diseases, kidney diseases, CKD, that means chronic kidney diseases, that might also cause. I mean to say is generalized systemic diseases which might also cause irregularity of periods. But that needs to be addressed by your gynecologist, and the doctor will be able to sort you out if that is the case. So, in short, irregularity of period is an issue, of course, and that needs to be addressed. The initial part of the period, irregularity is common. In the later part of your life, when you are approaching your menopause, then also the irregularity of periods will come up, and you need to be reassured that this is quite physiological, and you need to address something in between, like when you have irregular periods at the reproductive age group of 15 to 44. So if that be so, then you need to go to your doctor and address it routinely. In the later part, in the perimenopausal or menopausal, just before menopausal age, if the periods are quite delayed and you get a period quite suddenly, then that needs to be investigated. What we tend to do is we tend to do a ultrasound scan to see the endometrial thickness. If you did not have period for say over 1 year and now having bleeding, then the endometrial thickness is more, then it could well be that you need to be investigated for any malignancy. And if that is addressed in the earlier part, then there is more chance that you will have a very smooth life and everything will be sorted and in a you know in a good manner. So you will have a good life, so to say. So this, in short, is the irregularity of periods as today's topic is. So we can find out as to why it is irregular and then treat the causes accordingly. Thank you. I can take your questions now. So I can find a question that it's Nisha Narana. Have you have missed your periods and have gained weight? Is it that I am suffering from PCOD? I mean, it's not 100% that it could be stamped that you are suffering from PCOD, but it could well be because I have found patients who have those who have gained a lot of weight and their periods tend to go all over place. Vis-a-vis a patient who's lost her weight and was having irregular period initially is now started to having regular periods. So the next question is how much blood does the average woman lose? I mean, the loss of blood should be in a menstrual cycle should be less than 80 milliliter. So if it is less than that I mean you can say if you are looking at say around 3 to 4 tablespoons of blood, then perhaps over a period of over your 4 to 5 days of period, then perhaps you are losing the physiological amount of blood. If it is more, like if it is like you are having heavy periods more than 7 days, or if it is more than 80 milliliters, or if you are having, the number of pads are more, which is being used, and you are physically becoming anemic, and your stress and anemia levels by doing blood tests show that you are having heavy periods. So that could be another cause. What are the most common period symptoms? Most common period symptoms are, pain, if at all, some cramps in the lower abdomen, back pains, and sometimes bloating, sensation of fullness, and some of them could have excruciating pain in the first 1 or 2 days, and then it settles down. And, usually, it is not associated with pain, but sometimes it can, and you need to take medicines if the pain is severe and you cannot do your day-to-day work. What could cause a late or missed period? Addressing that, like if you miss your period and if you are in a reproductive age group, obviously you can look at like whether you have inadvertently fallen pregnant. Like आपको अगर प्रेगनेंसी है कि नहीं वो देखना पड़ेगा फर्स्ट. अगर प्रेगनेंसी है तो आप यूरिन टेस्ट करके देख लीजिए. Then you know that you are pregnant or not pregnant. If you are pregnant, obviously, then you need to address that going to your doctor. If you're non-pregnant, then this could be some other reason, and you need to address that as well. Why? The next question is why is there a spotting before a period? I mean, it is quite physiological. To start with, like if you open a tap, what happens? The water does not flow immediately. The tap is slow and the water draining out from the tap is slow. धीरे धीरे चालू होता है, फिर बाद में वो बढ़ता है जैसे कि टैप ज्यादा खोलती है. That's why the first 1 or 2 days, one first day perhaps the period is not so heavy. The next day it picks up and the periods are usually heavy on the second, third day, and that's how. So there could be spotting to start with. So nothing to worry about that. I mean, it's a very good thing, like that you are asking question about your daughter. Um, I mean, tell her that every woman will have period to start with, which is called menarche. So उसका शुरुआत होता है और periods होते रहते हैं और every month she is going to get a period which could be irregular to start with, as I have said in my lecture, and then perhaps it settles down to a 28-day cycle. There is nothing to worry about. If there is little pain, then you can use some hot water bag or some, ordinary painkillers to go with it. If it is not, then perhaps consider that everything is normal and she should do all her day-to-day activities along with the period. Nothing to worry about. So that's what we were discussing. What are the reasons for irregularity in menstruation? I mean, if we are looking at reproductive age group women, if there is some pathology in the uterus, in the cervix, then there could be irregular menstruation. It could be because of pregnancy-related causes like abortions, threatened abortion, missed abortions, and things like that. So you need to exclude whether you are pregnant or not. If you are not, then this could be because of polycystic ovaries, it could be because of the polyps inside, or it could be some local cause which might give some irregularity of questions. So, so this is in short today's session of about irregularity of periods. So to say, if you have any further queries, then you can contact me, and I'll be more than happy to give you the answers. Thanks. I mean, takeaway message is knowledge is power. You see, if you know that to start with the period that is, at the age of 12, 13, 11, you start your periods and you will be having irregularity of periods to start with, and there is nothing to worry about. So, so that knowledge is important. And also at the extremes of age, when you are perimenopausal, at the age of 50, you are not going to have a period irregular like someone who is aged 25. So that knowledge is also very important. That at the extremes of age, there will be irregularities of period. In between, there could be periods which could be, because of some other disease, some pregnancy-related conditions that need to be addressed by the gynecology.